just to recap, no surprise attacks, so PR, tube going, let her know, and slow. Yeah, no worries. And then just nice and slow, and just take your time. Absolutely brilliant. Now, what will happen is that Sazda and myself will support you through this test, okay? Sazda and myself will support you. She's just catching up on a few things at the moment, which is important.
आपके ट्यूब डाल रही हूँ, ठीक है? ये ट्यूब डाल के मुआयना करेंगे आप। कोई एक्सपोजर नहीं हो रहा ना, आपको पड़ता है यहाँ पे टिकट वगैरह। नलकी की होगी, बस और नहीं होगी आपको, ठीक है? रिलैक्स हो जाए। पेशेंट के पास आ जाए, सामने देखते हैं, पेशेंट से बात करते हैं।
Brilliant.
Because fecal matter was also there when.
So a little bit of air, a little bit more, a little bit more. Now yesterday, probably Vakar was saying to you, too much air, and Saad was going, too much air. There is a balance, okay? And it's finding that balance. At the moment you're in your early days, so you'll struggle to find that balance, and we're here to help you, okay? Misbah? You look like my daughter did, you know. Yes. So where's the lumen? Where's the lumen?
Lumen is from 3 o'clock.
Okay. So how are you going to make the scope? Not just with this, you can waggle this to the heart's content. But if you don't let it happen down here, it isn't going to happen. So what we have to do is bring this to here. Hand underneath, and now talk. That's it. See it? Good. Say again. Yep. Clean your lens and a little bit of air. Good. And take the scope back a fraction. And now you can see it coming to the left. So how are you going to make it look to the left?
Left or
9 o'clock.
9 o'clock. Anti-clockwise movement.
Good. Oh. Good. Clean your lens. Keep it cleaning, keep cleaning, keep cleaning. Excellent. No more air now, no more clean. Brilliant. Keep your finger away and just advance. Super. You're doing right. You're doing right. Keep looking up. You're doing right. Now how are you going to make it look to the right? Can you see how the folds are all going like this? Yeah. That's telling you which way to go.
I will come back probably at 10 o'clock.
No. Stop again, come back. Tip up. See it now?
Now I will move.
Yes.
Clockwise.
Yes. Not too much clockwise. And tip all the way back. So pull that back. Keep it. No, that's forward. That's back. Good. See? Good. Don't let go of the big wheel. You're keeping letting go of the big wheel. And just advance nice and slow. Advance nice and slow. Excellent. Nice and slow. Nice and you're doing excellent. Nice and slow. Nice and slow. Stop blowing and stop touching the air button. Keep going nice and slow. Nice and slow. I know, but what you're doing is that you're pressing it and it's got a little bit of spasm. So at this present moment in time, all you need to do is just tap, tap, tap. That suck. Now tap the air button. Good.
Coming back because
And now take the scope back 2 centimetres. Excellent. And tip up. So don't advance the scope. Okay. And tip down. And tip down. There you go. Now you can see where you want to go. Can you see that little red mark to the right? That's where you did that blip suck. Okay? So that's why we like to avoid it, because sometimes you'll see these things and you think, oh look, a red mark. We've caused it. Clockwise torque. Yeah. And big wheel forwards. Allow the big wheel to go forward slowly. Excellent. A little bit of air and a little bit of water. Now what's happening is you're hitting the mucosa now, but the lumen is down here at 7. Yeah, just a little bit. Just a little bit. Best way to do that, I'll help you. There you go. Yeah, look at the screen. So when I'm with somebody like me, Mona, I will like to keep this, because what I can do then is come along here and I can do this and I can do that. So you can see how the folds are going this direction.
Yes,
so if you allow the clockwise to come in, there you go, and tip up. And then, so I can control it and help her if necessary without actually touching the scope.
Instead of taking the stroke, you just leave it.
There you go, look. So she just needs that confidence. So what you do is that you do this and you step back. So Sad's just getting up to date, up to speed with what's going off. Now, see, I like this lady, because this lady, without any prompting, has asked that lady how she is. And that to me means a lot. The guys have to keep reminding them. Where's this lady? Now, whether that's a lady
That's
thing,
very important.
it's important to me. You know, so you get a lot more time in my book then as a result. So Mona, you would just stop there a moment. What do you think is happening?
I think somewhat a small loop, maybe.
Well, let's have a look at that thing over there. So stay still. Look at that thing. Is that a loop? No. No. What it is that it's showing that the scope is starting to push up a little bit in the sigmoid, and it's coming round looking at the distal descending. Okay? So not necessarily a loop, but what we've got to do now is just either commit to what we're doing. So is there enough gel on the scope? No, I'm asking you. You make the decision. Is there enough gel on the scope? No, I'm asking you, Mona. Is it getting stiff to actually advance this? Okay, so take the scope back 2 centimetres and put some gel on the scope. So if the scope is finding difficult to go in, don't think it's a loop. Go lubricant first. Now advance the scope, but make sure there's somewhere to advance it to. So you will have to just have a little look that at the moment you've crashed into the wall.
But I am coming back because
Okay.
I cannot.
Clockwise torque. If you're coming back, clockwise torque. Now anti-clockwise torque. Keep it coming on. Keep it coming on. Keep it a little bit of air. Keep the air going. Anti-clockwise. Draw the scope back. Anti-clockwise. Good. Now clockwise. Keep the air going and clockwise. Good. Anti-clockwise as you come back. So it's on, off, and now you can see it open up. There you go. Anti-clockwise. More? More. More anti-clockwise. Good. Keep going. More anti-clockwise.
Because of the lubricant, my hand is too.
There we go. Now tip up. Bit of air and tip up. Yeah, let's get near that there. Now look, see the folds? They're
Yes.
pointing upwards.
Clockwise.
And now relax and wait. Draw the scope back a centimetre. And you'll see it appear. Looks like it wants to go up, but it's more than likely going to go down to 4 o'clock. Keep coming back. And now look down, tip forward. Excellent, there you go. And advance. So when you start, I look at the time when we started the procedure. So I give the guys 30 minutes. If they're making progress, I just let you keep making the progress. At 30 minutes, 25, I start to add more input. At 30 minutes, stop it. And then we just advance. Keep going, nice and slow. Mona, you're doing absolutely brilliant, darling. Absolutely brilliant. Nice and slow. Absolutely super. Nice and slow. What's she saying, Mona?
Yes, she's saying there is some pain in abdomen.
Okay, stop blowing the air.
अम्मा थोड़ी सी हवा भरें, निकालेंगे तो सही रहेगी.
Don't suck.
Come back.
मैंने उसको खुद
So you can tell, I listen to the noises. So just listen to this noise here. Now Mona, do me a favour, just put your finger on the air button and blow air for a second. Put your finger on the air button. So, all right on it. Now take your finger off. So it makes, and it makes a very slight difference. That's brilliant. So we can hear that she's putting air in, so you listen to that. The suction is very easy to determine. So a lot of the time your hearing tells you what
But
to do.
usually when we do endoscopy, there is a lot of noise from the surrounding. We
Yeah.
cannot appreciate it. So we have to stand here and then listen.
You can, but I actually stand here because I've got no issues about what's happening. But the other thing that I tend to do is I'm looking around for things that help me. And I know that you're probably thinking daft, but you see like the black edge of the screen.
Yes.
The black edge of the screen, I can see a reflection, so I can actually see Mona's eyes in the actual reflection. So the reason why I'm stood here is I can actually, her eyes are hitting that and I can actually see back here. So I'm looking at what she's doing. So I'm looking at that, I'm looking at this, looking at that and listening to this.
Okay.
So there's a lot of things that you do when
You
you're,
have to use all your senses.
you do so that you're not actually... So Mona, what's happening, darling?
No, because I cannot see the lumen properly, that's why I am coming back. But I think lumen is there in the center.
It is. So what are you going to do? Have we got difficulty
Slide
advancing?
forward and then move forward, slide 1 centimeter back and move
Excellent. Never say slight, always try to be precise. Not because of anything to do with anything. It's just that if we, in the early stages, if we say 1 centimetre, 2 centimetre, it limits you and it makes you realise how far you can come back. So if you have to come back further, if I say 1 centimetre, if I say 3, 4, 5, 6, the next time you encounter it, you know you have to come back reasonable because you're coming back in, and it's easier to control as well.
I want this one here.
Yeah, go on then. Away you go, bit more. And advance, when you can see it's safe to do so. So where's the lumen? No. Do you have to do clockwise or is it tipped down? Is it tipped forward so you want to actually drop the nose?
Yeah.
Yeah. Okay, so a little bit of air. Why do you want to do that when the lumen's straight ahead of you? You've just said it's straight ahead of you. So come back. And a little bit of air. Come back. Keep blowing. And now you should be able to see the lumen. Where's the lumen?
Down.
4 o'clock, yeah? Away you go. The little red mark is where she sucked earlier. See that? Just advance, nice and slow. You're doing brilliant, nice and slow. So, that's it, well done. Keep the big wheel on and just wait. Just wait, just wait. Now, clockwise. Why have we gone clockwise?
Because light is less from there.
Yeah. So when it tips down, if you go clockwise, the scope turns left. Now if you go anti-clockwise,
Human is at 6 o'clock and we cannot find it. Like it's behind the, you can say, hold of glucose.
Because she hasn't got the skill set yet. What I would have done is put a lot of torque in the scope to bring it to 12 o'clock and tip up and gone. Because this is actually up. The fold has actually come here, and you've got to go here and down and forward.
Up and then
Yeah, you rotate the scope. So this fold is doing this to get over there. So you go up, down, and then up. Okay. So Mona, if I just take over just for a second, it's not for anything that you've done wrong or not that you've done anything inappropriate. It's just, brilliant, away you go. Excellent. So you put this on, you see this little thing? Now Mona's got lovely eyes. She makes me laugh just looking at her eyes. So she thinks I'm laughing at her, I'm not. It's just that when she smiles, her eyes light up. And I just think to myself, so she looks at me, she thinks, what's this fool laughing at? Are you caught up now?
what?
Are you caught up now?
Yeah.
Have you seen the names?
Yes.
I did. Should I move to clockwise or anti-clockwise?
Which is the least resistant?
Clockwise.
Okay, so what's your answer?
Clockwise movement.
Okay, and what's happening to anything anywhere else?
Also in the fold.
What's happening with the lady's left foot? She was waggling it. So you see, we're here, and you think that because I'm looking over there that I'm not looking.
I'll forget the patient.
Yeah. So just a lot of the time you've got to take on board. Look at the foot. You see?
Can I ask? Should I tell her?
अम्मा आपकी तबीयत कैसी है? अगर आपको दर्द हो तो बताइए.
You see the thing.
Very well aware.
She's very aware, but what she is, she's also very attentive. So Mona, the reason why I'm telling you is because she's listening to what I'm saying to you as well. So instead of instructing Mona, she's hearing what we're talking about, and then she's making a decision what to do. Now I'm stepping back slowly because Sad's just stepping in. So for your point of view, what I tend to do is that I like to listen to what's. I'd rather her see if she can make a decision for herself. The other thing is that she's had a bit of a hard time with the other guys, and her confidence has gone right down. And my job is to make her confident and comfortable.
That's the most important thing if you want any woman to do.
Well, it's not just a woman, it's the fact that it's everybody, but you know, I want it to be as comfortable as possible, and
ज़्यादा तो नहीं तकलीफ हो रही.
she, and I like her, and I want her to succeed, but regardless if you want, you've got to think about what's the best for the patient, and she needs to hear what we're saying, because then she's able, see how slow she's moving her fingers, compared to day one, she's moving things a lot slower. She's actually doing things a lot better with the hand. She's able to actually do things. So she's actually been very, very attentive and listened to what's going
Because
on.
she remembers everything you say. Whenever you repeat it.
I like that. I like that. But the other thing she's not doing, she isn't treating every case the same. Right, the last time he said, do this, do that, do this. The next patient, he said, do that, do this, do that. That's what the guys do. If you watch the guys, he's gone in, he's done that. He's gone in, he's done
Keep
that.
that thing in mind.
Yeah. Right.
Here, if I'll go in this situation, if I'll make my tip down and then clockwise down.
Yeah. What I would do is I would put a lot of torque in the scope to try and change. So instead of being here, I'd put a 360 torque into a 180 torque into the scope to
It
actually.
will make the fold to come upward.
Yeah, you're rotating it in the lumen so that then instead of it being down here, it's up there. And if you actually think then, as you pull the big wheel back, the tip will do this, but as you push the big wheel forward, it'll only do this. So it's limited. So going down, it's limited in what it can do. In pulling back, but as I said to you, this fold is one that...
You'll be doing two things. You will be making it move clockwise.
Yes.
And then again making the wheel go upward so that the tip will be this way. And then you will be enhancing it.
Yes.
Kind of, you're trying to engage the loop, the tip and the fold.
Yes.
And then making it move the fold itself.
So if that's the lumen direction, this fold is here like this. But because the tip is doing this, it cannot come past here, so that's what's happening. So what you have to do is rotate the scope, so it's still the same. Tip back,
Now,
up,
if it's like this, then you will be moving
yeah,
around 270.
and then down, and then forward. So this, so big wheel back, up over the lip of the fold, tip forward,
It will fall down.
and
The
then
fold will fall.
so if you look at the scope guide, the scope guide now shows that she's resolved that sigmoid and she's actually pointing up the distance. So what will happen now, to give her a rest in a minute, either Sazza or myself will take over in a minute just to get her on progress a little bit further, but she has negotiated the sigmoid and that's the hardest bit to do. So, but once she gets round this corner here, then that's what we need to do.
Now it's upward like this. So
Yeah.
all she needs to do is move it this way.
Yes.
Upwards.
Yeah. But then she also needs then to pull the big wheel back so the tips up and it goes forward. But what she's doing this. So that's the lumen and then she's lifting it up too far. And it's that, so it just lifts it up that fraction. See? So, see where the tip was pointing? So the big wheel's coming back too far. So Mona, just stop there a moment. How do you think it's going so far?
I think it is at the end of the sigmoid colon.
So end or, see, when somebody says to me at the end of the sigmoid colon, is it the proximal end or the distal end?
Okay. It is the proximal end.
Excellent. So if you just stop for a second, so that take your hand off the scope. So if we actually sit down, what's the most hardest part of the bowel to negotiate?
For me, it is like the sigmoid junction.
Okay, so you have got past that, so you've achieved that goal, yeah? The other thing is that you've had a good look at the distal end of the descending colon, haven't you? Because you've actually been able to get round the sigmoid.
Because I will check,
Yeah,
in where
but that's
we
where
withdraw.
you've been. You actually have been through the sigmoid, but you're just not able at the moment to commit to the next bit. So what I'm going to do is ask Sadda just to pass it on just a little bit further up into the descending colon, and then she'll just show you what we want you to do. Is that okay? Watch your hands, and if you and I stand here as she does it, and then I'll explain to you as she goes along. So just when she'll take over, she'll look at the scope, she'll see that all the wheels are neutral apart from this one. Not a problem, don't do anything with them. So what we do is that we take over from where you are. The most important thing for you is to understand that we don't let you get somewhere if it's not achievable to progress from where you've got to. And so it would be wrong to get you down into a position and then say, all right, let's take it back and let's show you how to do it. That's not the way to do it. What we have to do is show you that where we've got you, it is achievable. So if you hand over to Sajda, you and I stand here, and then if you stand exactly there, you'll see what's happening. So if you watch your hand, stand right there. No, right there. So Watch this. Don't watch the screen. You'll be able to see the screen. See the patient. The patient's shoulder has come back. So if the patient's shoulder went just a little bit further forward, right, that changes the orientation. See what she's done now? She's got that now so the tip is up. So she's rotated the scope like what we were saying, okay? And now it's going round. So a little bit of air. So what you're trying to do is negotiate, you're limiting yourself. So what Sandra's done, she's got the scope and she's rotated it so that the tip can come up, so you've got this amount of angulation. Because you're doing tip forward, you've only got this amount of angulation. Now if you look at what she's doing now, look at the right hand, the torque on the scope. The torque on the scope is going lovely. See the folds? The folds tell you which way to go. The folds are pointing, they're all converging. You've been there because it's a little bit puckered and you can see the little marks where you've sucked a little bit. What she's doing, she's done it so she's rotated the scope to do tip up. Remember what I kept saying to you? And the bit where you're going up, and to do it tip up, she comes up with the tip and now caught the mucosa at the bottom just a fraction, so she'll do anti-clockwise and clockwise as she draws back. And if you keep the clockwise on, this will come proximal, this will shoot up. Now watch what the hands do. So she goes in, this is forcing this up. But if you do a clockwise torque and draw back, see what she's done? Clockwise torque, draw back, and the scope goes forward. That pulls this down.
Okay.
Yeah? Then she's going to maintain that torque when it comes back. But you've got to come back and measure where you are. Now it's stepped away from you. That means that the loop is resolved. So if you keep that torque on, the scope now stays stiff. And then you can go forward. The only sad fact is that we've got a bit of stool, and you get tempted to put a little bit more air in as you go forward. Yes. If you look at what she's done now, she's slowing down a movement on the fingers here, and the hands there. See how loosely she's gripping the scope? So she's not strangling the scope, she's loosely gripping. The reason for the fingers is just to advance it in a straight direction. It's not to do this, she's supporting the scope with the buttons. A lot of people don't realise, even Sazra doesn't realise that she's actually turning the buttons. Watch. So if that's the point of reference where my hand is, watch where the buttons go. So my point of reference is here. She'll see what she'll do in a moment. She'll actually turn the hilt. See the hilt? It's now turned. So she's off the point of reference. She's turned it down here. And it's ever so such a slight movement, but everybody does it. They don't realise they do it. Who's, you know, been doing scoping for such a long time. Now when you've got a terrible prep, you actually think to yourself, am I going to give this person a credible experience? So Sazra now looks at us all wondering what we're all laughing at.
क्या वो दर्द हो रहा है? क्या हो रहा है? दर्द हो रहा है। ये थोड़ी सी हवा पड़ी है, इससे हो रहा है।
Brilliant. She's trying to go down the side between the stool and that. It's a very hard thing to do.
ठीक है आंटी, अब आराम है तो हवा है, कुछ नहीं, परेशान नहीं है, हवा निकालने है तो नहीं।
So So what she's done, she's put stiffness on the scope. Stiffness stiffens the scope 35 to 70. It's probably, now the most likely part that's stiffened is just outside the anus. See, now she's feeling difficulty. First thing you do when you feel is not necessarily think lubricant. You get tempted to put a lot more air in when there's bad stool.
Because of the poor.
So you cause things to be a lot more problematic. Good morning. Eric. So the thing that you should get is a lot of confidence when someone like Sylvester finds it a little bit difficult as well. Okay?
ठीक है आंटी अभी पहले से बेहतर है या हो रही है अभी दर्द दर्द हो रहा है बहुत हो रहा है जी
Sorry. So look at the hands. Little wheel is kicked back at the moment and she's trying to put torque steering on. So that will actually cause the scope to be like this. And when you try to put torque steering on, it does that instead of doing this and then you do the big wheel.
दर्द हो रही है जी और would you like to come over
Let's have a little go, my friend.
बहुत दर्द हो रहा है बहुत दर्द हो रहा है आंटी She's falling in lead. I was trying to reduce it, but still. बहुत दर्द हो रही है आंटी बहुत दर्द हो रहा है बात कर कितना दिया आराम है अभी बेहतर है कम नहीं
A lot of poo.
Paul,
Yes, sir.
good morning.
Good morning. I'm just wondering about the quality of the exam.
Sir, sorry to interrupt you. Would you like some running comments on this difficult situation for us? We are all trainees here.
Right. So running commentary. I'm about to bail. How about that? The prep is not ideal. As you can see, I've actually measured how far I'm coming back with bad prep. Can you see? So I'm going to tell you this. I've gone eight. So I've gone from here to here, and that's solid stool in that area. So, and I still saw no end in sight of solid stool. So if I've got that amount of solid stool now, I'm not going to give this lady what I class is a quality exam. As a result, we're not going to continue. This is a procedure that we can do, but it's not a procedure that we're going to be able to give this lady the answers. So 18 centimetres of solid stool coating the wall, we're not going to be able to wash it either.
Quite fair. Thank you.
But you negotiated the sigmoid.
Yes. I think it is also a treatment for me.
You did really well.